Hello and good afternoon and welcome to the UKIHCA Find Your Healthy campaign 2024. And today I'm delighted to introduce you all to, I'd like to say a friend, certainly a colleague, John Oxley. And I'd just like to say a couple of words about the Find Your Healthy campaign, which UKIHCA, that's the UK and International Health Coaching Association, has created as a public awareness campaign because far too many people still not really aware of what a health coach is, or more importantly, why they might want to see one. So I hope that by interviewing a range of interesting and inspiring individuals, such as John, that we can draw some attention and direct some people to the website to find out a bit more about how you might find your healthy, but also about how health coaching. So John, welcome and thank you for taking the time. Now,
Thank you.
today we've got quite a wide-ranging audience. So I know that your profile is very prominent in the physical activity sector, John, and increasingly beyond there, leadership. But could you just take a few moments to tell us a little bit about what you do and the work that you do?
Certainly. Well, thank you very much for inviting me on, Innes. And I would definitely, we've known each other a long time, and I would definitely consider us to be both colleagues and friends.
Thank you.
And as Ursa has just passed, I do remember many a discussion over in the States many years ago. So I do a number of things, I guess. Having been in the sport and physical activity space for a long time, all my career. But currently I'm chief executive of Life Leisure, which is a trading name of a company called Stockport Active CIC, which works right across the borough of Stockport in Greater Manchester. For my sins, in addition to that, I'm a board advisor for another local authority controlled trading company. I developed the transformational leadership program for GM Active, and so I've delivered that across Greater Manchester and wider. Number of other organisations have taken that program, and it's an area that I'm particularly interested in. And I'm a non-exec director of a company called Active Exchange, who's heavily into using data and insight in order to promote increased levels of physical activity, so we all move about a little bit more and become healthier. That's the mission.
Well, thank you for giving me the perfect segue into the next question, because there's a lot of discussion, particularly in the physical activity sector, about the move, or even we call the pivot, to health. And how could you describe, so you've got a broad role there, but you've mentioned health and you've mentioned activity many times. How would you describe the sort of the contribution that your organisation makes to improving health and well-being generally, John?
Great question. Very simple answer. I mean, I think that most of my work has been done in the public sector, and so just a little bit of background to where we're going to get to is that everything evolves over time, and the pandemic was an effect upon the physical activity space. Yes, it had the immediate effect of we weren't able to go anywhere, reduced levels of physical activity for lots and lots of people. But of course, in truth, the sector itself was starting to struggle and needed to reinvent itself. What was it there for in the public sector? And so when we've coming forward, a number of us really who have started to give this some more serious thought, and this word pivot or shift to well-being or active well-being came about is really because a handful of us were started to think about repositioning our part of the physical activity sector in a different way, because we needed to redefine our purpose. If I then take you to Life Leisure, we re-established a new organization conceived in the beginning of 2022. We've established what our purpose is, and our purpose simply is to improve the lives of others. Dead straightforward. That's why we exist. And if you make those types of profound statements, and we're doing it through well-being, one of the things that has become most important and much more understandable to us is that actually, for most people, we are certainly now thinking of well-being in terms of whole person well-being. We're developing our proposition around whole person well-being, and well-being now means or the health of somebody in our space, that's place that you and I have done all our work in our careers in this, is we've now realized that actually it's not just about physical activity. It's about and the health that you can derive from physical activity. It's actually about the mental well-being that physical activity provides, and the social connections that are provided as a consequence of participating in physical activity. So it's physical, mental, and social. And indeed, in terms of our organization, we redefined our purpose. We exist to improve the lives of others. Most notably, we're wanting to have an impact upon the health of the population and address health inequalities, as health inequalities now are significant. And if we sort of follow the work of Sir Michael Marmot from his report in 2010 to subsequent reports now, inequality is worsening, and we have to understand and find ways of dealing with that. And our organization is trying to do that. We have 2 parts of Stockport that are no more than 10 minutes apart, 3 miles, and the life expectancy in those between those 2 parts of Stockport is 11 years. You're likely to die 11 years earlier if you live and are brought up in one part of Stockport compared to another. It's it is significant. This is real serious stuff.
It's sobering.
And so
it's sobering.
it is sobering. And these are the things that drive us on and say, how can we change things? This shift to well-being. How can we change our thinking, and how can we change features of the system in order that we start to have the ability to improve the health of the population to a far greater degree than we've ever done before. And that's what our organization is trying to do. We've softened our branding, we've changed our language, we've spoken to people in the community. We do a lot of work actually where we go out into the community and understand what it is that they want before, rather than assuming what they want. And we've realized that, and our promotional campaigns are all based around evoking emotion. We no longer, i.e. the mental and social benefits of physical activity, rather than
not the
lose 3
perfect
inches
physique
off your waist.
Yeah, exactly.
So that's what we're doing, and we love
thank
it.
You. Thank you. And that resonates, because I'm sure a number of our listeners that maybe don't work in the physical activity sector, now you've mentioned it, they will recognize the change in the language. So that we're not talking about sport or performance or fitness, it's about movement and activity.
Exactly.
And health and well-being. So thank you to you and all of your colleagues for the work that you're doing in that respect. And then thinking about you, John, because that's why we're here today. I'd like to ask you, so when you're not doing all of that, and I know that you travel as well, what's your kind of go-to? How do you find you're healthy? What is the thing that you have committed to?
Well, what a great question. I mean, I guess, I suppose for me, it's been an integral part of my whole life. I was brought up by my parents, actually, wanting, being interested in sport and moving about and playing and being outside. So So that's what I did. You know, I was a footballer and I played cricket a bit, and then I just love sport, and I just love doing all of those sorts of things. And then you find yourself in this physical activity sector, because I remembered my dad saying, you know, you're a long time at work, do something that you enjoy.
Yeah.
You know, so this is why I'm here. So I'll try anything, but and so I've always been physically active. Things change over time, but I played football till I was gone 50. And but I suppose my go-to now is to cycle. That doesn't put any stress on my joints that have been taking a bit of a battering. But I suppose, so cycling is what I do. And I'm fortunate to have a smart bike in the garage. So when the weather's pretty rubbish, as it has been this winter, then it's no bother to me. I can jump in there and do as little or as much as I'd like. But it's important that I try to do something every day. And I was having this conversation actually with Michelle, who's known to both of us, actually. And even for me, who's been exercising all of my life, and I would call myself an habitual exerciser, it's not an easy, you know, sometimes you do have to force it. You have to find the time. You do have to force yourself to do it, even when it's as an habitual a thing as it is to me.
Yeah.
So for those who haven't been brought up like I've been, haven't got into that sort of routine of it being, you know, I mean, I would say, you know, exercise, my family, and work are the three most important things in my life. And it never changes. That those are, you know, getting the balance between all three is sometimes
The challenge.
pretty tricky. But you know, I would always have. It would never just be my family and my work. It would always be my family, my work, and exercise. That has to be an essential component. I understand that's not the
actually
same
a
for
very
everybody.
interesting. That's an interesting observation, John. So you're kind of saying that in terms of finding you healthy, when you're probably at your happiest or feeling healthiest, when all of those three things can be in balance, the time at work, the time with family, and the time maybe your own space on your bike, you know, pushing out the miles.
Yeah. And I think, you know, and I would almost go as far to say that my commitment and my ability at work and to my family are compromised unless exercise is playing a strong part. I'm better in those other two if I'm exercising.
Well, that's interesting, because my next question, you've already answered, was going to be, what impact does the cycling have on your you know, health and well-being generally? So thank you for that. Interestingly though, so now I think you do road cycling, if I recall correctly.
I do.
From looking at your Facebook posts, John,
Yeah.
and in some fantastic places and environments. But what hints or tips might you have for somebody who's thinking of, actually, do you know, I could give that a go?
To cycle?
Yeah.
Or just, yeah. Find somebody who you trust, who knows about bikes.
Yeah.
I think. So that cycling can be a very uncomfortable thing unless you've got your bike set up correctly. So
being physically uncomfortable. Yeah.
Physically uncomfortable. So a bike cycling is something that most of us can do. Obviously, there are some people, unfortunately, who can't. But it tends to be, you know, one of those sort of, you know, fairly straightforward, simple, well-recognized things that we can do. If we can balance and turn our legs, then we can cycle. But if your position on the bike is not set up correctly, and you've not got the saddle in the right place and the reach to the bars in the right place, it becomes uncomfortable and difficult.
Yeah.
So in order to get enjoyment, I would get those two things. I'd get some advice on those two things. And if you've not done it before, try to find some places, and there are places where it's a bit quiet and away from the traffic.
Yeah, and I know road cycling is your thing, but you know, people may probably be aware, but you know, cycling comes in very many forms. It could be a
Absolutely.
static. You mentioned I think you've
Yeah,
got a rolling road or a smart bike in
yeah,
your garage. That could
yeah,
be in your bedroom. It could be in a health and well-being, a fitness facility.
yeah.
It could be a mountain bike, a trail bike, a road bike. So there's many forms for people to kind of
There
try
are.
and discover. Yeah. But I
Yeah.
think your advice about the setup and the right equipment is important. And clubs, I guess you could go to a local club and
There are
get advice. Yeah.
clubs, and they tend to be, and there are lots of different types of clubs. Reach out to those, and largely very my experience of them is it's always been positive, inclusive,
Sociable.
friendly, help you, sociable. And it is, you know, one of the other things with cycling like that. I mean, I tend to do all my cycling on my own, but clubs are great because you get that social connection.
Yeah.
And there are some terrific stories of people who started out in cycling, and it's not serious, they're not trying to break any records, but the ability to be out in the fresh air, to be socially connected with others of a like mind, is terrifically wholesome. Yeah.
Well, that's a great point, probably just to wrap up on, John. So
Mm.
thank you so much. So, and that sounds like, you know, that is, we talk about whole health. So all of those
Exactly.
things, think beyond the physical activity, beyond the actual activity itself. And there are many other benefits to be derived
Yeah.
from whatever it is you might choose. And that, you know, that might not be physical activity. That might be, you know, mindfulness or something else. But
Uh, Absolutely. And I mean, I think, you know, what we eat, what we drink, the amount of fresh air that we get, the connections, the positive relationships that we have in our life, you know, they're all massively important to how we feel, and having a purpose. You know, there are times in
yeah,
you know, my working life where I've, you know, things have happened, and, you know, having purpose in your life is critical to your emotional
yeah,
well-being.
brilliant.
Yeah, there are many facets.
Thank
Definitely.
you. And if I can just kind of use that to amplify our message, which is about health coaching. And you know, a health coach is a person who's trained. They won't prescribe anything. They won't tell you what to do. They'll
Mhm.
understand what it is you want to achieve, what your purpose is, and they'll help you find the way to achieve it. It's about behavior change, because
It's a personal thing. It's a
those things you've
personal thing.
discussed, you know, whether it's activity, movement, or diet, you try to change any one of those things, and actually it can be a
Mm.
challenge.
Yeah.
And if you have to change more than one thing, it can become
Yeah.
really different,
Yeah.
really different. So, John, thank you so much for joining us on the Find Your Healthy
Interesting. Can
campaign.
I just follow up
Oh,
on just
you
that
can.
one thing, because it's so important. So you and I, when you and I first met, we were going to URSA and what have you, and behavioural change was absolutely, you know, you couldn't move. You'd hear about it all of the time. I sort of think over the last 20 or 30 years, we've lost a little bit of it. We don't talk about it as much, and I sense that it's re-emerging, and it's re-emerging, and that's a really good thing. My one little anecdote: one of the things that we're trying to do in Greater Manchester is connect across the system. So we're talking to public health and the health service and practitioners and all sorts of people, active travel, academics, and the like. We got everybody into a room from all different parts and said, you know, we've all got a vested interest in this, in enabling Greater Manchester to be healthier, the people of Greater Manchester to be healthier. What is it that would bind us all together? And the thing that we came up with was self-activation. Whether you're in whether you were a surgeon, whether you were a clinician, whether you were a physiotherapist, whether you're in physical activity sector like us, the importance, how could we get people to be capable of self-activating far more than they currently are, which essentially is behavioral change. And that's the
taking
one thing,
responsibility for your actions. Yeah.
Exactly. And how do we give people the information and the capability so that they're more able to make those decisions for themselves, without judgment? But the consequence is that they move about a little bit more, they live healthier, and that's better for them and for everybody. And I'm absolutely delighted that sort of behavioral change is starting to reappear, you know, much more positively on the agenda. Sorry, I interrupted, but I went off on one then.
Not at all. Listen, and thank you. It's all part of the same message. And listen, that may, you know, even further inspire somebody to have a look at what health coaching is about, behavioural change, or, you know, all of the good stuff that you're doing up there in Life Leisure. So
Thank you.
Thank you to you and your team, and you personally, John, for joining us. And if anybody out there wants to understand a bit more about what Find Your Healthy is, or how to find your healthy, and get inspired by conversations like this, you can go to our website, which is www.UKIHCA.com/FYH. So for now, John, thank you so much.
Great to see you.